and welcome to this News Unlock special, a show that goes well beyond the headlines to bring you stories that matter, stories that make a difference to all our lives. Today, in Corona times, we are going to take a look at a positive story. And what's the positive story? We are going to look at countries and places across the globe which have successfully dealt with the coronavirus pandemic. Remember, more than 17 million infections have been confirmed in at least 188 countries and territories. More than 600,000 people have died from COVID-19 globally. But there are some countries that are clearly ahead of the curve, countries that have successfully curbed the spread of the virus within their geographical boundaries. These are the countries which handled the initial outbreak swiftly. Today we focus on them and try to find out, what did they do right? Take a look.
The SARS-CoV-2 virus made its way to every country in the world. With more than 17 million cases worldwide, COVID-19 put to test each country's healthcare system and pushed its leadership under the microscope.
Bottom line is that one of the most fundamental ingredients for stopping this virus is determination and the willingness to make hard choices.
More than 7 months after the world was exposed to a new strain of virus, these are the countries that fared better than others in the pandemic. New Zealand. Although this isn't the country with the least number of confirmed cases, New Zealand successfully flattened the curve early on and became a great example of how the pandemic can be managed. By June, the country was even able to ease away from lockdown restrictions. New Zealand's first case came out on February 28th. The island nation was quick to close down its boundaries to outside travellers, and within days it had put in place strict lockdown measures. The country's healthcare system managed to handle the cases well, and financial policies allowed New Zealand's economy to jump back into action quickly.
We are not immune to what is happening in the rest of the world. But unlike the rest of the world, not only have we protected New Zealanders' health, we now have a head start on our economic recovery.
The Prime Minister Jacinda Ardern made headlines around the world for her swift management of the pandemic. Taiwan. The pandemic had a smaller impact in Taiwan than its neighboring countries, with a total of just 7 deaths. Life in Taiwan has been less disrupted than in countries with strict lockdowns. Taiwan had largely closed its borders since mid-March, but within the nation, restrictions weren't strict. But now a fresh wave of new imported cases has seen the government swing back into action. Iceland. Iceland has been praised for its handling of the crisis after an initial spike in cases in February. With less than 2,000 cases and 10 deaths recorded, the country fared well. The Icelandic government ramped up its testing and tracing program early on and closed its borders and introduced restrictions. Vietnam. Vietnam has had one of the world's best records in containing the coronavirus, despite sharing a border with China, where the virus was first reported. Vietnam managed to curb the spread by ramping up testing and contact tracing faster than neighboring countries. It put tens of thousands of people in quarantine when they were suspected of virus contact. But the ease in restrictions has now seen a second wave of infections. In the last 24 hours, Vietnam reported 45 new coronavirus infections in the city of Da Nang, marking the country's biggest single-day jump in cases. But these weren't the only countries that fared well in this pandemic. Fiji, Mauritius, St. Kitts and Nevis, Seychelles, Papua New Guinea, Trinidad and Tobago were some of the island nations that successfully fended off the virus. South Korea, Australia, Germany, UAE, Thailand, Canada all saw the infection curve rise before governments kicked into action and successfully tackled the virus spread. Cambodia, Laos, Timor, Bhutan, Mongolia were also able to rein in the COVID-19 infection before it spread through its relatively smaller populations.
What we are focusing on, as I said, are these countries that have shown remarkable progress in controlling the coronavirus pandemic. Our guest tonight, in a moment from now, is from the country of Canada, one of the other countries that seems to have kept COVID within check, in British Columbia in particular, without following harsh enforcement measures. Let's take a look at how Canada has fared over the past few months of the pandemic. What has it got right in the good fight?
Canada, with a population 1/10 the size of its southern neighbor, the USA, has so far recorded 8,917 deaths and 1,15,470 confirmed positive cases.
The situation is stabilizing in Canada because Canadians did their part and followed public health instructions.
Although the cases of COVID-19 continue to rise across the United States, Canada has largely managed to contain the spread of the virus, helped by strict social distancing measures and mandatory masks in several jurisdictions. And the reason behind the gap is visible at this famous tourist spot. At the Niagara waterfalls on the US-Canadian border, Canadian ferries are seen carrying just 6 passengers per boat in a ferry with a 700-person capacity. But on the US side, the ferries are operating at 50% capacity.
We took a picture of the boat. It's, I don't know, I don't find that it's very safe to be on a boat like that. So it's much better here.
Since the outbreak, Canada has reported around 30 coronavirus cases per 10,000 residents compared to the United States, which reported around 118 coronavirus cases for every 10,000 residents.
I'm glad I live in Canada. I just sent a picture to my friends actually going, the American, you can see why the pandemic is raging in the States and it's not in Canada when you look at the difference between the boats.
Reports also suggest Canadian authorities are dealing strictly with both unwanted tourists slipping through the border and permitted travelers, including essential workers. Reacting to the new normal, not just at border crossings but even within the country, Canadian cities like Toronto have embraced post-pandemic avatars of old activities. Fans of the Canadian band Monster Truck rocked out their music from the safety of their vehicles at a drive-in concert in Toronto. Concert-goers were seen dancing and singing along while seated inside their cars, parked a few feet from each other in a large parking lot specially designed for the new concept of drive-in concert.
Canada, as I said, one of the countries that has handled the novel coronavirus outbreak better than many, including, of course, its big neighbor, the United States of America. We won't go down that route at the moment. Now, much of the credit for handling the outbreak well in Canada is being given to Dr. Bonnie Henry, a Canadian physician, epidemiologist and public health specialist, associate professor at the University of British Columbia. She is now being decorated by the United Nations, among others. In fact, in April, while the rest of the world was still struggling to cope with the increasing case load, British Columbia was already flattening the coronavirus curve. And that's why she is the person who is being looked at by the rest of the world as a potential role model, someone whom the world could learn from. And her new book, also Soap and Water and Common Sense, is making waves. Now remember, it is Dr. Henry whose efforts have shown that it is possible to curb coronavirus. British Columbia has even reopened schools, restaurants and hair salons. She is someone who's also worked on Ebola in the past, and in fact a restaurant chain in Vancouver has named a cocktail after her. And when a Vancouver-based shoe company learned that she was a fan, they put out a limited edition release of shoes in her honor. So Dr. Bonnie Henry is someone who's making waves. As I said, she's someone who we would like to listen to. And earlier, I spoke to the leading epidemiologist and public health specialist from British Columbia in Canada, Dr. Bonnie Henry. I asked her, what did she get right in Canada? What could the rest of the world, including India, learn from the Canadian experience? Listen in to Dr. Bonnie Henry. How did British Columbia conquer corona in a way? You've been remarkable in controlling the spread of the virus, and therefore it's being used as an example by the United Nations for the rest of the world to follow. So give our viewers a sense of what you did right.
Oh, you know what? There are so many different parts of it. But really, I think it was being aware very early on that this could affect us. And we know we have lots of travel back and forth to China. So having that sense that we needed to be prepared early on. And then part of it, I think, was good luck as well. The timing of some of the decisions that we made. But I also think part of it was having a calm voice of providing people the information that they needed, and people followed that information. And I think that was an incredibly important thing. We were able to work together as a community here in BC to keep our numbers very low.
You know, Dr. Henry, there will be those who will say, of course, British Columbia much smaller than the large subcontinent that India is, and therefore easier to say practice social or physical distancing than it would be in India. Do you believe, therefore, that countries like India, just the sheer size of our population, makes us much more vulnerable than where you are? Was it easier for you, in a sense, to ensure that social distancing or physical distancing could be practiced than it would be for us in India?
Well, I think there are many things that are similar in our countries and many things that are quite different. We're very diverse in Canada and in British Columbia. And yes, we do have a lot more space than India, for example. And the population density is not so great as in some of your great cities like Delhi, for example. But we know we still also have the same challenges, that we're social creatures. We want to be together with people. We have large multi-generational families that live together. And that puts the pressure on, and the risk can be quite high. So, and we also have that sense of independence here, where people don't want to be told what to do and that they can't do certain things. So it's a challenge for all of us, particularly in diverse countries. And yes, I know there's some places in India, and I've heard of Kerala State, for example, where they've made great inroads in protecting people, particularly those who are more vulnerable from this. So I don't think it's impossible in any situation. But absolutely, challenges, we can't underestimate the challenges of having large numbers of people living in close quarters together. The challenges on our healthcare system, having those basic healthcare needs to support people, both who get sick from COVID, but all of those other healthcare needs that we have as well. So, we have done that very well here in BC, but it is a challenge for all of us. And it does entail working together as a community. And that's the way that we can best address those challenges.
You've already used the word community about half a dozen times. And I just wonder whether perhaps that's the model to follow, that certain governments have had top-down approaches, including one of the criticisms in this country as well, is that, we sort of tried to have shock, awe and fear tactics in the initial phase to force people to stay indoors. And over the months, we are finding that maybe communities are a better way to try and combat the virus, decentralize, empower communities. Do you believe that's a lesson? That this is not about strong leadership from the top, but encouraging people to work together at the bottom?
I think we need both, in that we need to have a coordinated message so that we're all saying the same thing. And we look at some countries where, the federal leadership may be saying things differently than the state and local leadership. As long as we all have a common message and we support each other, and this is something I believe, that if we tell people what we need them to do and why we need them to do it, and that it works, and we give people the means, and I think that's an important thing. Give people the means to do what we need them to do, and then we can work together as a community. The challenge becomes when you can't access food because you can't go out of your house and we don't have a way to support people, the essential services. And there's so many people that don't have any income if they're not working. So how do we as leaders make sure that we support people who don't have any income during that period of time when we need them to stay home? So that's where I think the balance between having strong government support and making sure that we do have that community action together makes a difference.
Let me come to your book, which is coming out, Common Sense, the Definitive Guide to Viruses, Bacteria, Parasites and Disease. Is there a definitive guide? Is there a one-size-fits-all that can work? Is it simply about maintaining common basic hygiene that you're suggesting, which is something that should be universally practiced now in this COVID era?
Well, I think that is absolutely one part of it. And actually, the title comes from a quote by William Osler, who is the father of modern medicine, many call him. And he said, soap and water and common sense are our best disinfectants, our best way of keeping safe. And so this book is about the difference between things like bacteria and viruses and parasites and how they affect us. But yes, there are some very basic things that we need to do, and that this pandemic has reminded us. Things like staying away from others if we're sick, covering our mouth when we cough, clean our hands regularly. And, hand washing is something that is such a basic thing that can be so challenging in some situations, but it's what keeps us safe from all kinds of things, because we don't get sick by having bugs on our hands. We get sick when we put them in our mouth or rub our eyes, and this virus is no different than that. So these are all what we call, maybe it's uncommon sense, but these are things that we need to build into our lives in an ongoing way. And right now with this pandemic, there are other things that we need to put into, and that is keeping those safe distances from people as much as we can, keeping our groups smaller so that we don't give this virus a chance to transmit really to large numbers of people. But no, the basic things are things that we've known for a long time, but sometimes are very challenging to practice.
So you're saying that basic hygiene is at the core of this fight? Is that what you're suggesting? That for individuals, for citizens, that is at the core of it, to ensure not just good health for themselves, but presumably for those around them as well?
Absolutely. And one of the things that we have learned about this virus, and we are learning a lot, is that we pass it on to people we're closest to. So for most of us, that's our family, our friends, our loved ones. And yes, sometimes we pass it on to people that we're not that close with, but we've spent some time with. So the things that we do to prevent transmission of the virus to others, protect those who are closest to us, but also protect those that we don't know.
The one thing that's also stood out as I was reading about British Columbia is that you've opened up restaurants, pubs. Here in India, we are stuck between lockdowns, unlockdown, and then a re-lockdown. How have you managed to successfully open up without having fresh outbreaks of coronavirus cases?
Well, we've done it slowly in phases, and we're looking at 2-week increments at least, because that's the incubation period. And we started with saying we recognize that we're not going to get rid of this virus completely. Even though we had a very low peak, we still have virus circulating. So what we're trying to do, our mantra is minimize the number of cases, manage them, make sure we're doing contact tracing, and public health is following up on every single case and their contacts, and then modifying as we go. So we started off slowly with certain types of restaurants, and we put in quite strict restrictions, and it was mostly outside. Then as we got used to it and people adjusted to how to do that, we allowed some inside, we increased barriers that could be put in place. So we really took it slowly, and we learned from each phase about what were the things that were working, what's problematic, And right now we're seeing people are traveling a little bit more within BC, and we're starting to see clusters in young people who are getting together and partying. So we're saying, okay, now it's important to be able to enjoy your summer and to have time with friends, but keep your friend bubbles small. Don't go with a different group every night. And that's how we're going to manage this for the next few months.
So it's a very step-by-step approach of an unlockdown. I think that's a lesson maybe that we could learn in this country as well. The direction is clear, but it's step-by-step. Let me ask you in conclusion, Dr. Henry, what is it about, dare I say, women leaders and their ability to effectively control corona? You know, whether it's the New Zealand Prime Minister, Jacinda Ardern, whether it's Angela Merkel, whether it's you out there in British Columbia, you all are now becoming the poster women, if I may say so, of the fight against corona. Is there any connection that I should draw or not?
I don't know. You know, I think it has to do with competence. And this is one thing that you know, I'm the voice and the face of a strong group of public health leaders here in BC, and you know, also our political leaders have taken our advice. So being good at what you do, having that scientific expertise, I think is really important. And maybe we bring a different perspective to it. I think it's a challenge sometimes for leaders talk about things like kindness and love, and how in a crisis, those are things that are going to get us through. But it really has resonated here, and I'm very grateful that people in my country and people that I've talked to around the world feel that this is an approach that has been effective.
Dr. Bonnie Henry, the woman who has taken Canada and indeed North America by storm by controlling coronavirus. And as I said, her book is out. It is Soap, Water and Common Sense. And I want to ask that question. It's a common sense question. Why do you think, I leave it to you to think about, why is it that women leaders across the world seem to have been far more effective in controlling coronavirus in several parts of the world than their male counterparts? Do you have an answer? Write in to us. Thanks for watching. Bye for now.
Hi everyone, Preeti Chaudhary here. Hope you like this video. For latest news and analysis, like and subscribe to the India Today YouTube channel. And don't forget to press the bell icon to stay updated. Thank you for watching.